let's talk about something many women experience, but don't always feel comfortable discussing: the menopause belly. If you're in your 40s or 50s and suddenly find it harder to keep your waistline in check, you're not alone. Even if you're eating healthy and staying active, that stubborn belly fat might appear and seem impossible to get rid of. But there's a reason behind it, and more importantly, there are proven ways to manage it. In this video, we're going to break down what menopause belly is, what causes it, and how you can take smart, effective steps to minimize it through lifestyle changes, exercise, and simple diet modifications. Whether you're dealing with these changes yourself or just preparing for what's ahead, this video is going to give you clarity, confidence, and control over your body during menopause. Understanding menopause belly. Menopause belly is a term that refers to the increase in abdominal fat many women notice during or after menopause. This change happens even in women who haven't gained a significant amount of weight overall. It typically involves a shift in body fat storage from the hips and thighs to the midsection, causing a softer look around the waist, lower abdomen, and sometimes the back. This isn't just about aesthetics. This change is driven by real biological shifts inside the body. One of the most significant of these shifts is the drop in estrogen levels that occurs during menopause. Estrogen plays a major role in how and where the body stores fat, and as it declines, the body may begin to store more fat in the abdominal area. This isn't just because of hormones, though. As we age, metabolism naturally slows down, muscle mass decreases, and physical activity often reduces, all of which contribute to body fat building up, especially in the belly region. It's also common to experience more stress and less restful sleep during this time, which can trigger the stress hormone cortisol, another factor linked to belly fat. So if you're noticing your body changing, especially around the middle, remember it's natural, it's common, and there are ways to manage it. Causes of menopause belly. There are several reasons why belly fat becomes more common during menopause. Hormonal changes are the biggest. When estrogen levels drop, the body tends to change how it stores fat. Fat that used to settle around your hips and thighs may now move to your stomach area. Lower estrogen, combined with an increase in male-related hormones like testosterone and androgens, can encourage fat to collect deep inside the abdomen. This is known as visceral fat, and it carries more health risks than fat stored under the skin. Another contributor is insulin resistance, which can become more likely as we age. This means the body has a harder time processing sugar and may turn excess calories, especially from sweets and refined carbs, into belly fat. Muscle loss is another silent reason for weight gain. Starting in your 30s, you naturally begin to lose lean muscle mass every decade. Since muscle burns more calories than fat even at rest, having less muscle means burning fewer calories, and the result is more fat accumulation, especially around the middle. Meanwhile, a more sedentary lifestyle, whether due to desk jobs, lack of motivation, or just feeling more tired, reduces your daily calorie burn. Factor in poor sleep, which affects your hormones related to hunger and appetite, and high stress levels that raise cortisol, and you have a perfect recipe for belly fat that seems impossible to lose. Genetics also play a role. If the women in your family typically carried weight in the belly after midlife, chances are your body might follow a similar pattern. But don't worry, while genetics set the blueprint, your lifestyle determines what actually gets built. The key is to understand what's happening inside your body so you can take back control and begin to feel more like yourself again. Health risks of excess abdominal fat. Gaining abdominal fat during menopause is more than a cosmetic concern. It's closely linked with serious health risks. The buildup of fat around the belly is often visceral fat, stored deep within the abdomen, where it surrounds vital organs like the liver and intestines. Unlike subcutaneous fat just under the skin, visceral fat is metabolically active and increases the risk of several diseases. Women with an expanding waistline after menopause face a higher chance of developing heart disease, type 2 diabetes, breast cancer, and dementia. This risk is present, even if overall weight remains stable, making it especially important to monitor waist circumference in midlife. In addition to physical health, excess belly fat can worsen menopausal symptoms like hot flashes and poor sleep, contributing to an overall decline in quality of life. Solutions. Fixes for menopause belly. Reducing menopause belly requires a holistic approach that addresses lifestyle, diet, exercise, and sometimes medical care. Lifestyle changes make a significant difference. Regular physical activity, such as brisk walking, swimming, or team sports, helps burn calories and reduce fat throughout the body, including the belly. Aim for at least 2.5 to 5 hours of moderate intensity exercise per week, or an equivalent mix of higher intensity and strength training. Building muscle is vital because it boosts metabolism, making weight and fat loss easier as you age. Incorporating activities like Pilates, yoga, resistance training, and core-focused movements can help restore muscle and reduce fat. Effective stress management is another key step. High stress increases cortisol levels, which promotes belly fat accumulation. Practicing mindfulness, meditation, or deep breathing techniques can lower stress and assist with weight control. Good sleep is equally important, since lack of restful sleep disrupts appetite hormones and can increase cravings for unhealthy foods. In some cases, hormone therapy may be helpful for women with significant menopausal symptoms that interfere with activity and healthy eating. Discuss with your healthcare provider whether hormone replacement is appropriate for you, as it can also help reduce risk factors for heart disease and diabetes in select women. Natural remedies like increasing fiber intake, drinking herbal teas, and adding probiotics may support digestion and reduce bloating. Massaging the abdomen with essential oils and practicing regular self-care can also help improve comfort and a sense of well-being. Diet tips for managing menopause belly. A thoughtful diet is crucial for reversing or preventing menopause belly fat. Focus on whole, unprocessed foods and prioritize nutrient density. Mediterranean and low-carb diets, which emphasize vegetables, fruits, legumes, whole grains, lean proteins, healthy fats like olive oil, avocados, and nuts, and moderate dairy, have been shown to reduce abdominal fat and lower the risk of chronic disease. Increase your daily intake of fiber-rich foods, such as whole grains, beans, lentils, berries, apples, and leafy greens, to regulate digestion, stabilize blood sugar, and help you feel satisfied longer. Fill your plate with colorful vegetables and opt for complex carbohydrates like oatmeal and brown rice over refined grains. Include protein at every meal to support muscle mass and keep metabolism active. Good sources include fish, eggs, tofu, chicken, and legumes. Healthy fats are your ally. Choose sources like fatty fish, salmon, sardines, flax seeds, walnuts, and extra virgin olive oil. These not only help control appetite, but may also improve hormone balance and fight inflammation. Some women find value in adding foods rich in phytoestrogens, like soy and flaxseed, which can gently support estrogen levels. Limit intake of processed foods, refined sugars, sugary drinks, high-sodium snacks, and trans fats, all of which can promote fat accumulation around the waist. Drinking enough water combats bloating and helps metabolism. Try small, frequent, balanced meals to avoid overeating later in the day, and plan meals in advance to stay on track. Supplements such as omega-3s, vitamin D, probiotics, and magnesium may offer added benefits, but should be considered after consulting your doctor. Remember, sustainable changes bring lasting results. Consistency, rather than strict dieting, matters most when managing menopause belly. Exercise recommendations. Engaging in the right types of exercise is one of the cornerstones for reducing menopause belly and maintaining overall health as you transition into and through menopause. Creating a well-rounded fitness routine means looking beyond just one form of activity and embracing a blend that addresses cardiovascular health, muscle strength, flexibility, and balance. Start by making cardiovascular exercise a regular part of your week. Activities like brisk walking, swimming, cycling, or even dancing are excellent options that not only help burn calories, but also improve heart and lung function. Aim for a total of at least 150 minutes of moderate intensity cardio per week. This could mean 30 minutes a day, 5 days a week. Spread your sessions throughout the week for the best consistency and benefits. Cardio workouts accelerate your metabolism in the short term and over time help manage overall body fat, including the stubborn fat that settles around the belly during menopause. Strength training is equally important, especially as you age. With hormonal shifts, the natural loss of muscle mass speeds up, making it easier to gain fat and harder to keep weight off. Incorporate strength sessions at least 2 times per week. These don't require a gym. Resistance bands, light dumbbells, or your own body weight can be used for exercises such as squats, lunges, chest presses, rows, and push-ups. Strengthening your muscles not only revs up your resting metabolism, the amount of calories you burn at rest, but also builds lean muscle, which gives your body a toned look and supports joints and overall mobility. Don't neglect core exercises, which are particularly helpful for posture and midsection tone. Core stability workouts might include Pilates movements, targeted abdominal exercises like planks or bicycle crunches, and routines that challenge balance, many of which can strengthen deep abdominal muscles and support your spine. While these moves improve muscle tone and functional strength, it's important to understand that doing AB exercises alone won't melt belly fat in just that area. Fat loss occurs throughout the body as you reduce your total calorie intake and consistently engage in all-around activity. Adding flexibility and balance work, such as yoga or Tai Chi, is also extremely beneficial during and after menopause. These low-impact activities gently stretch and lengthen your muscles, increase range of motion, and improve your ability to stay steady on your feet. Keeping up your flexibility helps prevent injuries, improves joint health, and reduces tension or stiffness that can come with age. The most critical component is consistency. Choose activities you enjoy, whether that's group fitness classes, nature hikes, dancing, or swimming. Setting achievable goals and tracking your progress can boost motivation and ensure you keep moving forward. By investing in a variety of exercises each week, you'll not only target menopause belly effectively, but also enhance your mood, energy levels, and long-term quality of life. Menopause belly is a common and natural part of aging, caused by hormonal changes, muscle loss, shifting metabolism, and lifestyle factors. While it may feel challenging, you hold the power to take positive action. Prioritize whole foods, stay active, manage stress, and aim for restorative sleep. Approach the journey with compassion and patience. Long-term success comes from gradual, sustainable changes and self-acceptance. Your health and well-being are worth the investment at any stage of life. If you found this video helpful and want more support and practical advice tailored for women's wellness after 50, be sure to subscribe to Senior Woman Health Plus. Join our community for the latest tips, encouragement, and expert-backed strategies to embrace every stage of your health journey with confidence and positivity.